Hi, my name's Shay Walsh. I'm the uh, team lead nurse for Greenstaff HomeCare, complex care, and I've got a couple of topics questions that I'm going to discuss with you today. Now, the first thing is to have a navigate disagreements. The first question is navigating disagreements for patient-centered care. So to start off, before we go into the specific questions, I just need to highlight the background to all these types of questions. So as nurses, we undertake something called best practice, which underpins everything. This is in nursing, it's evidence-based approach that promotes high quality care, patient safety, and positive health outcomes. These practices are shaped by clinical experience, research, and regulatory standards, and they guide nurses to delivering safe, ethical, and efficient patient care. All nurses and nursing associates, we must comply within the UK to the Nursing and Midwifery Council Code, which covers professional standards of practice and behaviour for nurses, midwives, and nursing association. So this code underpins everything that we do as well. So the first question is, how can nurses effectively communicate their concerns about a doctor's recommendation while maintaining a collaborative approach to patient care? So effective communication between nurses and doctors, any health discipline, to be honest, is essential for maintaining patient safety and ensuring high quality care. When a nurse has concerns about a doctor's recommendations, it's important to address these concerns in a way that promotes collaboration rather than confrontation. Because we all have to work together at the end of the day. So here's a couple of strategies that I've come up with that hopefully will help. Now, number one, and the first one, and something I'm very passionate about, is using the SBAR communication framework. Now, SBAR stands for Situation, Background, Assessment and Recommendations. It's a widely accepted communication tool in healthcare settings. It provides a structured way to express concerns and facilitates clarity. So, what does these acronym makes up then? So first of all, situation. Let's briefly describe the current situation. Background, provide a context or relevant background to the information. Assessment, share your assessment of the situation, including concerns and any observations you've done. And then recommendation, offer a suggestion or seek clarification on the best course of action. So here's just an example. So you phone up a doctor because the patient is unwell. So first of all, you say, doctor, the patient's blood pressure is dropping quickly. That is the situation. He's been on the new medication for 24 hours. That's the background. I'm concerned there may be a side effect. Assessment. Could we review his treatment plan or consider adjusting his medication? Recommendation. And another thing to add on to that with recommendation is quite important. If you want to review, do say, I would like you to come and view this patient straight away, please. Okay, that's very important. And it's what's been found out in the past is certainly junior doctors didn't really understand how to prioritize or how serious the situation. So if you as a nurse says, I want you, you're actually telling them, I want you to come and view them straight away. They know that that will be the top of their list or they need to come to next. Okay, so another thing is ask for clarification. So sometimes as simple as a request for more information can highlight concerns in non-confrontational manner. By asking a doctor to explain their rationale or their decision making, you can come up with a dialogue and ensure mutual understanding. So an example in this, I see the patient has been described a high dose of medication. Could you help me understand why this approach was chosen? Why did you decide that dose and what was your rationale? Okay, sometimes just this asking the question will prompt the doctor thinking, actually, have I done the wrong prescription? So something like that. Focus on the patient's well-being is another reason. So by framing your concerns around the patient's safety and well-being, this can shift the conversation from being about a personal opinion to a shared goal of providing best care for that patient. So an example on that is, I'm concerned about the patient's discomfort after the last treatment. I wonder if there's any way we can modify the treatment plan to ensure they remain comfortable and stable. Okay. Uh, Next one, be respectful and collaborative. So maintaining respect is crucial to foster trust. When expressing concerns, avoid language that could be perceived as accusory. Focus on working together to resolve the issue rather than on a disagreement. So such as, I think we're both aiming for the best outcomes here. I just want to be sure we're not overlooking anything important or has anything been missed. Something like that. Next one, provide evidence or observations to back up your concerns. So again, presenting these can lend weight to your argument without making it personal, such as, I've noticed patients' oxygen saturations have been increasing steadily since the medication change. Do you think we should reevaluate? Uh, and then another one is using assertive language. So again, assertiveness is not aggression. It helps convey concerns clearly while respecting the other person's role. State your concerns confidently and express your desire to find a solution together, such as, I'm really concerned about this patient's current state. I believe we need to reassess the treatment plan. Another one, follow up after the discussion. So if the doctor accepts your suggestion, it is essential to follow up on the patient's response to the revised care plan. If your concerns were not acted on, continue to monitor the patient and revisiting the conversation with additional data may be necessary. So it's a keep, if things are not working out, keep going back and asking for more. And again, every time you request this from the doctor, please document that to back you up in the future. So when do we de-escalate? So again, if you think the patient is in danger and the concerns are not being addressed, then you may need to escalate. So these could be to someone, say, such as the ward manager, senior nurse on duty, a lead nurse, your line manager, the doctor's line manager, which tends to be a consultant, and again, out in the community, GP practice manager. Also, don't forget that also formal reporting is necessary, such as using a Datex in the NHS or your organisation's own equivalent. So anything like that must be reported and noted down. So by approaching concerns thoughtfully, nurses can maintain positive working relationship with doctors while advocating the best practice for patient care. Can nurses used to assertively advocate for their patients' need when they believe a doctor's recommendations may not be in the best interest? So advocating for patients' needs is critical responsibility for the nurses, especially when they believe a doctor's recommendations may not be in the best interests. Assertive advocacy requires balancing respect for the healthcare team while ensuring the patient's well-being is prioritised. Here are some strategies again that nurses can use to help with this. Okay, so being well informed. Uh, so knowledge is power. As you've probably heard before, and certainly when you're advocating for a patient. So ensure you're familiar with the patient's medical history, their current condition, treatment plan, as well as any guidelines and evidence-based practice, but also what their wishes are as well. Okay, because you're an advocate for that patient. This provides a strong foundation for expressing concerns and making your advocacy more credible. Such as an example, based on the patient's history of kidney disease and the current lab results, I'm concerned its medication will increase the risk of complication. What are your thoughts on this, doctor? Again, use evidence-based communication. So presenting your concerns using evidence, clinical data, and professional guidelines strengthens your argument. If you believe a treatment might harm the patient or is not ideal, referring to specific studies, clinical guidelines, or similar cases can support your position. For example, doctor, I've read the patient's lab result, and according to the latest clinical guidelines for patients with similar conditions, this treatment may not be the best option. So another question is, what strategies can nurses use to assertively advocate for the patient's needs when they believe a doctor's recommendation may not be in the patient's best interest? So advocating for a patient's needs is our critical responsibility for a nurse, and it's one of our major roles, that we need to take on the voice of the patient. So especially if you believe the doctor's recommendation may not be in the patient's best interest, then assertive advocacy requires balance and respect for the healthcare team while ensuring the patient's well-being is prioritised. So here are some more strategies that nurses can use to effectively and assertively advocate for the patients. So we'll be well informed. So there's a great quote from somewhere that says knowledge is power, and it certainly is from advocacy. So you need to be ensured that you're familiar with the patient's medical history, their current condition and treatment plan, as well as any relevant guidelines and evidence-based practice. And also, what are the patient's thoughts around certain aspects of their care and treatment as well. This provides a strong foundation for expressing concerns and making your advocacy more credible, such as an example is, based on the patient's history of kidney disease and the current lab results, I'm concerned that this medication may increase the risk of complications. So another way is to use evidence-based communication. So by presenting your concerns using evidence, clinical data and professional guidelines strengthens your argument. If you believe a treatment might harm the patient or is not ideal, referring to specific studies, clinical guidance, or similar cases can support your position. So a good example is I've reviewed the patient's lab results, and according to the latest clinical guidelines for patients with similar conditions, this treatment may not be the best option. Okay. Um, can we discuss what are further options that could be explored? Something like that. Again, frame your concerns around patient safety, which is important. So patient safety is your ultimate priority as a nurse in healthcare. So frame your concerns in terms of patient risk. When your advocacy centres on protecting the patient from potential harm, it's more likely to resonate with the doctor and the team, because no one wants anything worse than a safeguarding or safety aspect being encroached. So an example is, I'm worried that proceedings with this plan may increase the risk of infection or complications for this patient, given their current condition. The other thing is to bring in the wider team, so ask for an MDT discussion. So instead of, of challenging the recommendations outright, invite the doctor and other members of the healthcare team to engage in a discussion or case review. This promotes teamwork and reduces the likelihood of confrontation. Example, I think it might be helpful to view this patient's case as a whole team, considering their recent changes. Could we take a few minutes to reassess their treatment plan? But don't forget, remain professional and respectful. So it's important to maintain a respectful tone when advocating for patients. Being assertive doesn't mean, as we said before, being aggressive. Keep your communication professional, even when a disagreement arises. So I understand your perspective, but I'm seeing things from the patient's bedside and point of view, and I have concern about how they're responding to the treatment. There we go. And then another thing is using I statements. So when advocating for your patient, focus on how to you perceive the situation rather than directly criticizing the doctor's recommendations, even though you may want to. Using I statements are non-confrontational and reduce defensiveness. So things like, I feel the patient's symptoms are worsening since the medication change. I'm worried that this could lead to further complications if we don't adjust the treatment. Next one is offer alternatives. So again, this is very good. It's not just presenting with an issue or problem, but offering some alternatives. And some certainly doctors and junior doctors will take that on board due to their lack of experience. So rather than simply rejecting doctors' recommendations, suggest alternative options or ask other treatments have been considered. Offering alternatives fosters collaboration and problem solving. So have you considered reducing the dosage or trying a different medication that may be less risky to the patient, this type of patient? So again, offering alternatives and working collaboratively as well. Seeking support from other colleagues. So if you feel your advocacy is not being heard, again, it may help to involve other healthcare team members, such as another nurse, a senior nurse, or another doctor. Assertive training teaches nurses how to speak up in a high stress situation without being confrontational. So by using these strategies, nurses can confidently advocate for their patients, ensuring that concerns are heard and maintain a collaborative approach for the patient care. So going on, how can nurses build confidence in their professional judgment and assertiveness skills when facing disagreements with doctors regarding patient care decisions? So being confident in professional judgment, assertive skills is crucial for nurses when navigating disagreements with doctors regarding patient healthcare. And again, when we say doctors, it could be any member of the healthcare team, to be honest. I've certainly had situations where I've had to discuss patient care with physios and OTs and dietitians and people like that. So developing these qualities, again, enables nurses to advocate effectively for their patients while fostering a collaborative healthcare environment. So the key strategies under this you could try are enhancing clinical knowledge and skills. So confidence grows from competence, okay, by continuing enhancing your clinical knowledge and staying current with best practices, evidence-based guidelines and research, you'll feel more assured in your ability to make sound judgments, okay? So having that background clinical knowledge gives you that competence and confidence to grow. So you need to participate in continuing education programs, attend seminars and view the latest medical literature, stay up to date with advancement in patient care. So the other thing is to seek mentorship and peer support. So learn from experienced colleagues or mentors can help you build confidence in your judgment. A trusted mentor or experienced nurse can provide guidance on how to approach difficult conversations and share strategies for advocating assertively. So identify a mentor within your healthcare setting to join a nursing network to seek advice on navigating professional challenges and honing assertiveness. Now, where I work at the moment, there is some nurses within the office environment around the country. So we've all teamed up together with a little team chat where we share concerns and ask for advice and support. And there's certainly one nurse that I have a meeting with every week for half an hour, just to share any clinical concerns and have peer support with. Great, fantastic opportunity, and I recommend it for any nurse to do that. So practice assertiveness in low stakes situations. So start practicing assertiveness in less clinical situations to build your confidence. So this can include asking questions in meetings, participating in case discussions, or speaking up during shift handovers. Practicing the lower sort of types of environment will prepare you for more significant disagreements going forward. So another thing is to practice assertiveness in low stake situations. So start practicing assertive in less clinical situations, and this will help build your confidence. This can include asking questions in meetings, participating in case discussions, or speaking up during shift handovers. So practice these in sort of the low stakes environments will prepare you for more significant disagreements. So again, say use assertive communication techniques you've learned during team huddles or patient rounds or in doctor's rounds to make your voice heard. And even if it's a small concern, just raise your voice so you're heard. Okay, then go on, try the other thing you could try, utilize role-playing sessions. Now, not everyone likes this. Unfortunately, I do. So what you can do is simulating difficult conversations through role play can help you practice how to express concerns with confidence. Role playing also helps to refine your ability to use non-confrontational language and develop responses to various reactions from doctors and other team members. So organise a role-playing exercise with colleagues where you practice advocating for patient or raising concerns about a treatment plan. Focus on using techniques like I statements and, as we said before, SBAR. Okay, and that will help guide you and aid you in that. The other thing is developing emotional intelligence. So emotional intelligence, or EQ as it's known, is the ability to recognize and manage your own emotions as well as understanding the emotions of others. Strengthening your EQ helps you approach disagreements with empathy and professionalism and make it easier to remain calm and assertive when faced with conflict. Okay, so practice self-awareness by reflecting on your own emotional response to difficult situations. Develop strategies for managing stress. Cultivate active listening skills to better understand the concerns of doctors and foster collaborative discussions. And this is something very much that I personally use in the next big question, okay, which we'll discuss in a minute. So the other thing is adaptive positive self-talking and reframe negative thinking. So negative self-talking can undermine confidence in your professional judgment. Instead, use positive affirmations to boost your self-assurance and reframe negative thoughts as opportunities for growth and learning. So an action on that would be something like, when faced with self-doubt, remind yourself of your expertise and past success in advocating for patients. Reframe moments of disagreement as chances to grow professionally rather than as failures. So again, it's something we do a lot of nursing. Again, it's a reflection a bit, self-reflection on how you handle situations. And the most important thing I always say is believe in yourself as a nurse. Okay, that's the most important thing. Again, what we mentioned about start small and build confidence gradually. So confidence and advocacy develops over time. So begin voicing concerns, as we said, about smaller issues, but then build to more complex issues to gain experience. So each conversation will reinforce your belief in your personal judgment. So set personal goals to speak up in specific situation. Start by advocating for smaller adjustments to a patient care and build up to more significant interventions as you become more comfortable. Use structured command tools, communication tools like we mentioned before. SBAR, excellent, please use that. It helps organize your thoughts, reduce ambiguity, provide clarity when communicating with doctors. Again, other structured tools also provide a framework for assertively expressing your concerns, making it easy to be confident in your action and in your actions and in your communications. So practice using SBAR during patient handovers or when discussing care plans with the healthcare team. This framework helps presents your concerns in a concise, evidence-based manner. Okay, learn to manage conflict constructively. So develop conflict resolution skills which will give you tools to manage disagreements, Instead of avoiding disagreements with doctors, learn how to approach them with confidence and problem-solving mindset is key. So there is plenty of courses out there and workshops on conflict resolution. I do recommend them for not just nurses, for anyone in any walk of life to use for handling disagreements, tact and professionalism, practice finding common ground in college. So please utilize them. And as we said before, reflect and learn from each experience. So after each encounter, you voice your concerns, reflect on the experience, whether the outcome was favourable or not. It doesn't matter in a way. Identify what you did well and what could be improved. Continual self-assessment builds your confidence and helps you improve in time. And obviously, what I suggest is use the NMC reflection form to reflect on situations you were successfully advocate for a patient or handled a disagreement, or you weren't successful, as I said, and how could you have improved things? So identify where you could have been more assertive and create an action plan for the next time. Don't forget, if you do any reflection, this can be used as part of your revalidation. Okay, so keep it safe. The other thing is to seek constructive feedback. So ask for feedback from colleagues, mentors, managers after situations where you've had to assert your concerns. Constructive feedback helps you refine your approach and increases your confidence in making decisions and speaking up in future situations. So again, after challenge conversation, seek feedback on how you handle the situation from the nurse in charge or any other colleague or anyone's around. For strong professional identity, understanding the value of your role as a nurse and how you can contribute to the healthcare team is essential for building confidence. And this is play a unique and vital role in advocating for patients, and recognise the importance of this role can help boost self-assurance in challenging situations. So reflect on your responsibilities as a patient advocate and remind yourself that you have a duty to speak up when you believe the patient's care could be improved. And then again, celebrate small wins. So recognize and celebrate your achievements when you successfully advocate for your patients. These small wins will reinforce your belief in your professional judgment and help build momentum to continued growth. So acknowledge the positive outcomes of your assertiveness, whether it led to a change in the care plan or simply open a conversation with the healthcare team. The other thing is you can think about lastly in joining professional organisations. So engaging with nursing organisations or advocacy groups can help you stay connected with a supportive community that shares your own goals. These organisations offer resources for professional development and advocacy, further strengthening your skills. So joining nursing bodies or unions or specialty organisations within your field of practice, participate in discussions and advocacy initiatives to enhance your skills. These all have a wealth of resources available. And again, also the NMC has resources as well. So by following these strategies, nurses can build their confidence in professional judgment and assertive skills, ultimately enhancing their ability to advocate for patients effectively and collaborate with the healthcare team. As I said before, don't forget all these strategies that we just talked about can be used as evidence in relation to your CBD, part of your next revalidation. Okay, so do keep all that evidence that you've recorded and written down. So what, as I said, what has just been discussed as well is supported by the Nursing and Midwifery Council, the code. So this code contains the professional standards that registered nurses, midwives and nursing associates must uphold. So nurses, midwives and nursing associates must act in line with the code where they are providing direct care to individuals, groups or communities, or bringing their professional knowledge to bear on nursing and midwifery practice and other roles, such as leadership, education or research. The values and principles set out in the code can be applied to a range of different practice settings, but they are not negotiable or discretionary. They are mandatory.